Hi, my name is Pamela, and I'm a local business owner here in Minneapolis. I was rear-ended by a distracted driver, unfortunately. The pain became progressively worse until it became debilitating, and I could no longer work. For 2 years, I would wake up in the middle of the night with pain like 3 times a night. My quality of life was so diminished. Couldn't spend time with my family, my friends. My friends would call, "Where are you?" It's just pain is so draining, and I didn't see light at the end of the tunnel. I went to see my primary care doctor. He ordered physical therapy. I saw 3 different chiropractors. I had different treatments, everything they had to offer. I had 6 epidural injections. None of them helped. I was at a pain clinic, being given a pain patch, and pain medicine and muscle relaxants. And then I decided to get surgery consults. When I saw Dr. Jackman, I had already seen 3 neurosurgeons and another orthopedic surgeon who all recommended a major spinal fusion, which I was uncomfortable with because I had friends that had fusions and they failed. Dr. Jackman was very thorough and precise. He educated me. He was giving me options that I hadn't been given before.
I'm Todd Jackman. I'm an orthopedic spine surgeon and practice at Midwest Spine and Brain Institute in Minnesota. Today we're here to talk about the sacroiliac joint, often called the SI joint. The SI joint is the base of the spine. So as the spine comes down, it meets the sacrum, and then the sacrum has 2 joints, one on either side, that connect it to the ilium. So it's really the foundation of the upper body meeting the lower body. The sacroiliac joint is different than other joints in the body. It doesn't have a ton of range of motion, but it does have a ton of force applied across it. Typically, patients with sacroiliac joint pain will have localized pain off a midline, one side or the other, troubles with standing on one leg, laying on that side, find themselves constantly adjusting their position to get more comfortable. Occasionally, they'll have pain that radiates down their legs because the sacroiliac joint can irritate the nerves as they pass by and mimic some of the symptoms some might see with a low back problem. The SI joint in studies has been shown to be prevalent in 10 to 30% of patients that are coming to the office complaining of low back pain. The most important thing with the sacroiliac joint is just listening to the patient. They're going to tell us where the pain is. They always take their finger and point to that one spot, the back side of the pelvis, just slightly off of midline. Then I'll take the patient through several tests, and that's the hands-on part, where you really have to touch the patient and try maneuvers to further aggravate the area. If I'm hearing the SI joint as a potential source of the pain, and then seeing that with examination that is potentially the source of the pain, the test that I do to confirm it is a diagnostic injection. That injection has 2 objectives. Number 1, they put numbing medicine in. So does that help the first couple of hours after the injection? That is extremely diagnostic. And I'm looking for somewhere 75 to 80% relief of that pain. That numbing medicine wears off, but the doctor typically has also put in a corticosteroid, an anti-inflammatory agent that may take a couple days to kick in, but can give people longer lasting relief. So when would a patient choose to have surgery? It's that time in their life where they can't do the things they want because that specific problem is giving them trouble. So that's when I bring it up. I bring it up when I hear that it's affecting all aspects of their life, and I know that they've tried all the conservative measures. That's the time where surgery potentially can provide some help. Early in my career, although I recognized the sacroiliac joint was a potential pain generator, I didn't have a good option for patients that needed surgery. That's changed. The method I currently use is through a much smaller incision than historically was done. It's typically 2 to 3 centimeters in length, over wires that are placed with x-ray into the appropriate position in the sacroiliac joint. You can then place 3 small implants without disturbing the muscles. The surgery takes about an hour. It's typically outpatient. For the first 3 weeks, I like to have people take the pressure off that side. So I'll either have them use a cane or crutches, occasionally a walker, to protect that side in the early going.
Since I had iFuse, many things have opened up. Now I'm able to meet with my small team And actually, we meet together about the business and about marketing. Instead of doing this just by phone, I went back to school for nursing, and I'm a straight A student. I mean, I couldn't even travel before. There's no way I could ride in a car more than half an hour. It was so uncomfortable. Now I can fly out east to see loved ones. I have a trip planned in March, and I can enjoy the holidays with my family, which I couldn't before. For the first time in like 5 years, I'm able to wear my heels again. I love wearing heels, so I wore heels today, and I'm able to cross my legs again, which I couldn't do before. I've had my life given back to me.
If you feel the SI joint may be the source of your pain, I welcome you to join me in the office and we'll work on a treatment plan together.